Now I'm going to discuss what normal shoulder mobility looks like in a pitcher. How much internal and external rotation is enough? How much is too much? First we'll talk about GIRD, or glenohumeral internal rotation deficit. This is seen in most pitchers. This means that the internal rotation of the throwing shoulder is significantly less than that of the non-throwing shoulder. And since having a sufficient amount of internal rotation is so vital to stay healthy, GIRD has been given a negative connotation and seen as a highway to injury. However, studies done by Dr. Mansky, Mike Reinold, Dr. Kevin Wilk, and many others have shown that a healthy pitcher's shoulder looks like this, where this would be a right-handed pitcher. Their throwing shoulder has a significantly increased external rotation and decreased internal rotation compared with that of the non-throwing shoulder. However, both of the shoulder's total motion add up to 180 degrees. Now this is just shown in one picture. It doesn't have to be 180 degrees. But the important concept is that the total motion of the shoulder should be within 5 degrees bilaterally. And remember the study done by Dr. Wilk, where if the throwing shoulder has less total motion by more than 5 degrees, then they're at a higher risk of injury. In an attempt to further analyze these findings, other studies done by Dr. Crockett, Dr. Meister, and others have found that there are actually bony adaptations that occur in the throwing shoulder. The shoulder joint is actually retroverted, meaning the joint itself is twisted into external rotation. This means that every pitcher will have GIRD. This is normal. However, the total motion should be near identical. I'll also note that in all these studies, the mean total motion of both shoulders came to be around 180 degrees. However, there was a standard deviation of up to 15 degrees, and this is coming from Mike Reinold, who has worked with a countless number of healthy big league pitchers. He has seen shoulders range from 150 degrees of total motion to 200 degrees of total motion. But the important concept here is that the total motion is symmetrical in both shoulders. Now I want to recap the main points of this 3-part video series. First, the total motion of the shoulder is a much more important number than just internal rotation. Pitchers will have less internal rotation in their throwing shoulder because of the retroversion of the glenohumeral joint. However, that loss of internal rotation should be coupled with a subsequent gain of external rotation, and the total motion should be within 5 degrees when compared with the non-throwing arm. Next, pitchers will lose internal rotation up to 24 hours after pitching, and continuing to pitch with this loss of motion can lead to injury. So it's important to restore and maintain the baseline total motion number over the course of the season. The primary function of the rotator cuff is to stabilize the humeral head inside the glenoid cavity during any type of shoulder movement. In order to function properly while pitching, the rotator cuff muscles need to be strong enough to dissipate the powerful acceleration forces that are generated to throw a baseball at high velocities. They also need to be fast or timely, meaning they have to be firing at the right time to stabilize the humeral head effectively. Lastly, they need to be well conditioned. The cuff muscles need to be able to stabilize the humeral head not just in the first inning, but with every single pitch being thrown. Up next is the demonstration segment. Here you can find safe and effective ways to restore internal rotation and various shoulder strength and stabilization exercises for all 4 muscles of the rotator cuff.